in Ontario and Michigan, and she became involved in infection prevention and control in 2001. She was the lead of infection control at Sault Area Hospital from 2005 to 2011 and was involved in the design and construction of our new hospital here. In 2014, Vicki spent 3 months working as an infection control consultant for the World Health Organization Ebola response team. So please welcome to the stage, Vicki Willet.
Thank you, Charlie. Can you guys hear me okay? I'm not good at standing still, so this is going to be really hard having to stand here. So I just want to thank the committee for inviting me to come and speak and for Nikki to contact me. I hope you guys find this presentation interesting. I've spoken at a couple of places about my experience in West Africa with Ebola. And it's always kind of interesting. I like when I get feedback and evaluations. Usually when I do a presentation, I really try to incorporate that for future presentations. This is a little bit challenging because this is really my personal experience and what I saw happening in West Africa, in Sierra Leone. But some of the feedback I get is, you know, oh, that was really interesting, we really liked it. And other people write, well, I don't really see how this is relevant to me. So that's fine. I guess for me, what I hope that you get out of this is maybe just some interesting information. Perhaps you're inspired a little bit to think about nursing in different roles, specifically infection prevention and control. So I hope to see some new ICPs out of this, or just sit back and enjoy the pictures. So how did I end up going to West Africa, Sierra Leone? Back in 2014, there was a lot of headlines in the summer. I can't believe it was that long ago already. 2015. What year is this? 2015. 14. There was a lot of headlines happening about the outbreak in Sierra Leone, and specifically a lot about healthcare workers getting infected while they were at work. And I was watching all of this, thinking, holy cow, what the heck's going on over there? And interestingly, in August that year, a call for help came out from the World Health Organization through a lot of professional associations. And they were looking for, of course, epidemiologists, physicians, and specifically the role of infection prevention and control. So to me, I just couldn't ignore it, and I really felt strongly that this was something maybe I could lend my skills to help get this outbreak under control. And fortunately, my husband and family were very supportive. And by November, I was finally ready to go and on board to become a consultant for the World Health Organization to go to Sierra Leone. It's quite a process, a lot of immunizations and preparation to go. Really weird training things about what to do if you get attacked and taken hostage and left in the jungle somewhere, which I kept thinking, thought I was going for an outbreak, not some terrorist activity, so that was kind of weird. So I ended up going, my initial plan was to go for a month, but as discussions took place with the World Health Organization and just looking at the need and talking to people who had been, I finally agreed to go for 3 months on a contract. So first place I had got to go was Geneva. You are sent to the headquarters of the World Health Organization for a debriefing, which was really just overwhelming. You're put in one of these big rooms and everybody's talking about what's going on, and you've just arrived literally 2 hours ago after an overnight flight and you have no idea what's going on. And you get sent to the medical department where they basically give you an emergency kit and say, good luck. So the emergency kit they give you was huge. I had to carry this thing with me, and they have IV supplies, dressing supplies, antibiotics, and I had all my anti-malarial drugs. Yeah, 4 condoms I think are in there. I wasn't really sure, but okay, 4 condoms, just in case. In an Ebola outbreak, let's see, spread by contact with body fluids. Don't think I'm going to be, am married, but anyways. I opened it up, I'm like, 4 condoms? Okay. So off I went to West Africa. So I went to Sierra Leone, just a little map here to show you. These are the 3 main countries that were hit with the Ebola outbreak: Liberia, Sierra Leone, and Guinea. And this was kind of new to these countries. Viral hemorrhagic fevers are not necessarily new. Sierra Leone's dealt with Lassa fever, which is another hemorrhagic fever in the past, but they've never had Ebola. So just to kind of help you guys kind of put into context a little bit about Sierra Leone. The average life expectancy in Sierra Leone is about 47 to 49 years. So I was old. Versus Canada, you're talking in the 80s. There's a real lack of education. The literacy rate over the age of 15 is around, I think, 40% or something like that. Most people can't read and write. It's one of the poorest countries in the world. So Haiti, we all hear about Haiti, is one of the poorest countries in the Americas. But Sierra Leone, Liberia, Guinea, they're some of the poorest countries in the world. So they have no healthcare system. When you look at their, I don't know if I have on there, I can't see, the physicians. Physicians, they have about 4 physicians for every 100,000 people, which in Canada we have around a couple hundred. So for a doctor to get Ebola in Sierra Leone and die devastates the country because that's one less physician. So this, I don't know if you guys are familiar with an epicurve, an epidemiological curve. This is a curve kind of tracing the outbreak, the numbers of cases. So this is the epicurve for Sierra Leone specifically of confirmed cases of Ebola. So these are ones that are, I don't know if I can get this to work, lab tested. Can you hear me? Okay. So this is the start of it back in January 2014. This is kind of where we are right now. This is November, December, January 2014, 2015. So that's when we had the highest number of cases, and that's when I showed up in Sierra Leone. I'd like to say that, yeah, see, I got there and got better, but no. Infection control. So there's a few things to think about when you walk into an experience like this. This was a huge outbreak, one of the biggest the world has ever dealt with. There were multiple agencies involved. So we're not talking a couple of people. It wasn't just the World Health Organization. I believe there were 127 agencies. So you're talking United Nations, World Health, UNICEF, Plan, Goal, the United Kingdom military. I can't even remember. Save the Children. There were so many the CDC. Everybody was there. Everybody wants to help. Everybody wants to do their own thing. They all have their own guidelines, their own agendas, their own funding, what they're going to do. So trying to coordinate all that, you can just imagine. All of the schools were closed, and most of the hospitals were closed. All the smaller health units were closed. A few of the larger government hospitals were open, but all they could do was manage Ebola cases. So if you had a heart attack, too bad for you, there's no care. If you got hit by a bus, too bad for you, there's no care. If your child was sick, if they didn't have Ebola, there's no care. And the kids were not in school, so we also know, as a result of being out of school for a year, the teenage pregnancy rate is really high. Those girls will not return to school, so this is going to have huge long-term impacts on those kids, right? Because the country is going to have now a whole group of young girls that are not going to finish school because they're pregnant. And we had cross-border issues. Remember I showed you the map with Guinea, Liberia, and Sierra Leone, and there's borders. Those borders are just lines on a map. People don't respect those borders. They travel between the countries freely. You know, they might live here and their villages, home villages, you know, however many miles away, and they just go back and forth. So trying to control transmission between the countries, very complicated process. You have to take into consideration the political environment. This was a country that was ravaged by civil war. Everybody know the movie Blood Diamond? Leonardo DiCaprio? Took place Sierra Leone in the city of the district of Kono, which I had been to. So when you look at that country and you hear about all of the Long Road Home, I think is another book from child soldiers from Sierra Leone. So this country's been ravaged by warfare. They do not trust their government. The government is corrupt. There's definitely some corruption. I saw it. Could see what was happening. There's not much you can do about it. But it makes it hard when the government's supposed to lead an outbreak response and provide information and the people don't believe it. They didn't trust the messaging. We have a lot of social and cultural traditions that we have to be aware of, and you have to figure out how you're going to manage that, because you can't just come in and tell people to stop doing things when that's their history and that's their culture. So physical contact, specific burial traditions, which all lead to the transmission of Ebola. When you look at contact with body fluids, is one of the main ports of transmission, and we want to wash bodies when they're being buried or prior to burial. That's a huge risk for the population, but they don't want to stop because that's their tradition. A lot of traditional medicine and traditional healers, again, they don't have much of a healthcare system, and they're in a chiefdom structure still. So even in the big cities, they go to the chief. So they'll have the local community chief and the female leaders, the mommy queen. I don't know, you guys probably don't know a lot about outbreaks. I don't know if you've experienced it in your nursing career yet so far as students, or if some of you may have been doing a clinical rotation and there might have been an outbreak. But there's a specific response that you need to look at putting in place. Taking into consideration all of the context that we were working in, this was kind of the different pillars or the different pieces of the response for the outbreak. So you can see there's several different pieces all trying to work together. You had social mobilization, you have infection control, safe and dignified burials, case management, so that's a lot of your nursing and physician care of the patients, epidemiology and contact tracing, because we've got to find the cases. If we don't know where the cases are, we can't stop the cases. And logistics, just trying to get supplies in the country. So these were all the pieces, and of course I was infection prevention and control, but a lot of what we did, we had to work with social mobilization. And social mobilization was done formally and informally. It was really interesting because they hired people, anthropologists and social workers and different people to talk about how to message to the communities on the things they needed to do to keep themselves safe. And then randomly people would just do their own thing. This little guy on the left here, he was just I actually thought maybe he was crazy, but he kind of scared me, and I walked on the other side of the street that day because I thought, ooh, because he had this like machete thing, but it was wood. I wasn't taking any chances. He was just walking up and down the street with a sign, Ebola is real. And when I found out, just by asking a few people, he was a really respected traditional dancer in the community. So he was just trying to get people to, Ebola is real. And then all throughout the country, people would just randomly set up checkpoints, and that's what's happening in the other picture. The community would just band together, they'd put up a little rope across the road, and they'd stop you, and they'd check your temperature, and they'd make you get out of the car and go wash your hands, and you could get back in the car and continue on your way. You know, what they were going to do if they actually found someone with a fever, we really didn't know, because these were just people that, like, we didn't really know what they were going to do, but they felt like they were doing something to prevent Ebola from getting into their community. So it was constant. Another checkpoint, you can see they've got the little rope with a bunch of stuff across the road. You never knew when they were going to be open or not. Signage was huge. There were signs all over the country. Everywhere you went, there were signs about Ebola. Random places would stick them up, Ebola. And of course you had to put it in their language. They spoke English, but they also speak Creole. So Cork Union say Ebola real, avoid body contact. I liked this sign. I think thinking about literacy and the fact that people may have difficulty reading them, I don't think you can get much better pictures than this, with the poor guy vomiting in the middle there and the other guy with the diarrhea. If you have those symptoms, you might... That's a nice after lunch photo there for you guys. I just thought, wow, that says it all. I think that was a UNICEF sign. So what was I doing in West Africa for infection prevention and control? Education was a big part of it. We really wanted to identify gaps in practice in the Ebola centers, and then work with the Ministry of Health and Sanitation and the partners. So all of these other organizations that are coming in and setting up centers and setting up treatment areas, we wanted to work with them to make sure they were following the World Health Organization guidelines for infection control in an Ebola center. We worked with the CDC to follow up on any healthcare worker infections. So if we heard about a nurse or an ambulance driver or a cleaner getting an infection, we would try to meet with the family, with the CDC, to go through what happened here, how did this happen. And we also wanted to Think about the future. They had nobody. Infection prevention and control does not exist in Sierra Leone. So we really wanted to look at how can we start training nurses and doctors about infection prevention control and build that expertise for future. And we partnered with Infection Control Africa Network for that. So Sierra Leone has 14 districts. I was really lucky, I guess you could say that. I spent most of my time in the Western District. I went to Moyamba. I went up to this one here, Bombali, and then over to Kono, which this is a couple hundred kilometers, I think like 200 or 300 kilometers, but it takes about 8 hours to drive there because there's no roads really. So it was quite the challenge. When I stayed in Sierra Leone, this was my hotel. It had running water, so that was nice. It mostly had electricity. Sometimes the internet worked. This was the view. It was kind of neat because outside of my room, you had the ocean right there, and there was this little fishing village right here. This is actually a close-up of it. There's about 700 people that live there. They have no running water, no toilets. They had one pit toilet, so a hole that people could use for a toilet. Their garbage is literally just everywhere. They burn it all the time. Everywhere you go, there's always burning garbage. People are burning it. Unfortunately, we had 22 cases of Ebola 2 weeks before I left in that area. And so trying to control the transmission in these slum areas is really, really challenging because they have no running water, no toilets, so we have to bring them water, we have to figure out what to do with the garbage, and you're keeping these people in these little houses. This is the World Health Organization office. It's not very exciting. It was pretty run down. It was kind of scary. The road to it's a dirt road, and there was big potholes, and you're bouncing all over just going into work in the morning. It was a bit challenging. I wasn't there very much. At the British Embassy, there was the command center set up. It was like a massive room, and there was all of the different pillars, social mobilization, case manager, they all had a little section, and we had whiteboards, and we'd write up all the cases on the whiteboards, and what facilities, how many cases they had, how many beds were available, so they could figure out where to send people once we knew where they were. So my area was free, the western area of the province, of the country, that district, which included Freetown, the main capital. So you have the western urban and the western rural areas. It's about 550 square kilometers to travel. So sometimes I spent half my day just in the car getting from one end to the other. It could be quite challenging. Freetown itself, it's a beautiful city. It's got rivers and it's right on the ocean and the mountains are there. It's quite lovely, but it's so crowded and there's so many slums. You can see here all the housing just along the river, and there's no sewage. There's no infrastructure. So there's no sewage systems, there's no water systems, there's nothing. This is a shot. I was in a helicopter. We were going to Kono, and this just kind of shows you how close these houses. So if any of you are thinking about public health nursing, just imagine the challenges on a regular basis. All these people crammed in these houses in poverty, no running water, no toilets, no electricity. They just pee on the street, that kind of stuff. Actually, I had a picture of a sign, I don't think I included it, says, "Do not urinate here." I don't think it was very effective. Even in the cities, it's crowded. You're trying to drive down these streets. There's markets everywhere, people everywhere, which all leads to challenges when you're trying to control a disease that's spread by contact with blood and body fluids. So you're trying to go through, and all these people are sitting right there, and they would just vomit right there on the street. You know, your risks are huge for these people. In the rural area, things are a little bit more spread out, but still the same issues. No sanitation, no garbage control. It's just all lying all over the place. And just getting around, like I said, took hours. The chickens and the goats are everywhere. They're living in smaller huts, so it was a real difficulty. In fact, for World Health people, the people that were over there, doing the response, our greatest risk was actually traffic accidents and injuries related to car accidents because the driving conditions were so bad. Actually, this is my car here with my driver. First day, the whole front wheel fell off the car. We didn't even get out of the parking lot. It's like, okay, this is good. And I was lucky. I was assigned a car and a driver because I had to cover all of the western area. And you spend a lot of time with these people. I spent hours a day with my driver on the left, is Amin. He's a young man, married. His wife had a baby during the outbreak. I was really quite anxious because I was really worried about them having this baby in the middle of an Ebola outbreak. And then the other fellow on the right is Wahid, and he's about 24. First day he drove me, he ran out of gas, kind of like my son. Right out of gas. I was like, perfect, we're stranded with no gas. Here we were driving and the wheel fell off the back of the van. It's like a lot of traffic accidents. As you can see, the driving was really challenging. When people ask me, were you scared? This is what scared me. Driving around this country was really quite scary. There's no traffic lights, there's no stop signs. Occasionally there'd be a policeman out there trying to direct traffic, but they usually just got out of their car and yelled at him and got back in and continued on their way. It was very dusty because it's dusty. And in December and into January is the Hamatan. So you have the winds from the Sahara Desert blowing across Africa, so it's always dusty. At first I thought maybe it was pollution or something, but it was just dust. So your eyes are always irritated. I don't know how people with respiratory issues like emphysema, asthma manage, because it's really quite dusty for about a month. This is just, we were driving to one of our Ebola facilities, and they were doing road construction, and out of the blue, they cut a tree down. No signage, no stopping the traffic, just boom, this tree fell down. My God, then they came out and started cutting it up. It was very crazy. Trying to get through the market, it took us about an hour and a half to get through that traffic jam, and as we were trying to go through, I wish I could have put the audio clip in, the ambulance and the burial team were trying to come the opposite way. So it was very loud and noisy, and dealt with that every day. And then you had police checkpoints along the way. Like I said, I did have the opportunity to go by helicopter, which was really cool, to the district of Kono. That, I think, in terms of Ebola, was probably my most frightening moment. I got deployed there because there were, I think, 87 deaths in a very short period of time. It was in the news. There had been at least 3 or 4 healthcare worker deaths in the hospital. The place was a disaster. When we landed in the helicopter, which those pilots are Russian and don't speak English, and everything in the helicopter, all the safety information is in Russian. The kids were so excited. They all came running up from the village to meet the helicopter, and they were kind of swarming us. And all I could think about was, okay, there's a lot of Ebola here. You don't know which one of these kids has a sick parent or family member at home, what they've maybe touched, and I don't want them touching me. So you're trying to tell them, okay, back, they're just excited. Ebola, no touch. So I found taking their picture, okay, stand back, taking their picture. They were really excited, and it got them away from me. It's like, oh my God. And this was the headlines that were happening at the time when I got flown in there for 3 days. They were just finding bodies everywhere. And in fact, one of the Red Cross burial teams was attacked by some villagers while I was there. So, education and training was one of the big things we were trying to do. Mine was mainly focused on site, so I tried to do on-the-job training with the nurses and the physicians in the Ebola care centers, just looking at their practices, looking at their hand hygiene, how they're putting all their personal protective equipment on. So these are some of the nurses at the nursing station in one of our Ebola centers. It was nice. I think they just finished picking the lice out of their hair. That was comforting. It was a bit like, it's funny because I found my journal. I tried to journal, and I was looking at it, and I had written about visiting that facility and how upset I was because there was a lot of issues. I found needles lying around, not capped, just lying around in an Ebola center, where it's spread by blood and body fluids. They had just left needles lying all over the counter, and they didn't have any sharps containers. So I had come across it with the physician I was working with, and she went to pick up the papers, the wrappers, and I said, wait, don't. And we're all in PPE, right? So you can hardly talk, you're in the stuff, you're sweating buckets. I'm like, don't just grab them. And I lifted them, and sure enough, there was all needles on the countertops. So it was such a scary moment. And while we were in there, one of the nurses that we were working with, we had to get this patient out and try and get him a shower and get him out of the center because he was Ebola negative. But the guy was a big guy, and he had the N95, the masks on. It didn't fit his face properly. So when he bent down, his mask flipped up and covered his eyes. So it was up under his goggles, and so he couldn't see. And so we had to literally lead this guy out of the center to somebody else to help them take his PPE off, because you don't dare bring your hands up to your face and touch anything. The risk is too high. So that was a scary day, and I think I wrote about it that day in the journal, and one of the things I put was, and to top it all off, they're picking lice out of their hair. The Chinese medical team was there. They were there in a big way. There was a lot of, the Chinese government has a lot to do in Sierra Leone. They're quite involved, and so they had their military hospital. That was really, really interesting. Yeah. Yeah, they seem to be investing in Sierra Leone. So they're in there. From what I understand, they're doing a lot of mining, because Sierra Leone has gold and diamonds, right? So they're in there for the resources, and they're building roads. So they've actually built some beautiful highways right in the Freetown, and they're providing some hospitals and things like that. So the Chinese were there, and we toured their Ebola center, but they wouldn't let us in most of the areas. Nope, you can't go in. And they would have like these video screens. It was really kind of strange. And they had cameras, and they had videos, and they would let us look at that. And I could see things happening. I'm like, well, that person's in the red zone and going out into the waiting room and going back into the red zone. And they're like, nope, all red zone, nope. And they wouldn't let us in. So we were trying to talk to them here, and then they wanted official photos. And I'm sure I'm somewhere in China in some kind of official photo. Here we were working with some staff, doing some training, and this was their room to put their PPE on. It was very small. There's little shelves. Everything was pretty dusty. Actually, while we were there, the one wall fell in. On the whole thing fell over. It was not very good. Their system for nursing is actually really kind of interesting. They have various different levels, and it's kind of based on the British system. So all the nurses are called sisters, and then the leading nurses are matrons. So the chief nursing officer for the country is the matron. So this is the matron, and we worked with her. Actually, while I sat in her office to meet her one day, I was kind of freaking out because a great big cockroach was crawling along the curtains. And all I could focus on was, I hate cockroaches. There's a big cockroach up there. If he goes down, I'm going to freak, and that's not going to be good. She's a lovely lady, very knowledgeable, very supportive of her nurses in the country. And so we did a lot of work with her on providing education about infection prevention and control. And we partnered with Infection Control Africa Network. So these were some of the staff and some of our nursing students that we were teaching infection control. We ran a 2-week education session. And this was our first round of graduates from the program, and some of them are now working for the World Health Organization as infection control leads for the country. So, and I'm trying to work with Infection Control Africa right now to see how we can continue to support from our local chapter here some of these people in infection control and their ongoing learning needs. So like I said, we did assessments. So education was one piece. We did, I don't have a timer, so I don't know the time we're doing here. But if someone can let me know if I'm running out of time. Okay. We looked at the flow of the Ebola centers. This is something we even do here in Canada when we're looking at hospitals. The design, the flow, is it allowing the best practices to happen? So there were some really well-designed Ebola care centers that were really impressive, and this is a couple photos of some of them. They would have designated areas for putting personal protective equipment on. It was all laid out nicely. They had nice areas so the nursing staff could stand over here and view the patients in there, because really you cannot stay in there for long. About an hour is about as long as you could stand. So they would send 3 shifts in. Like you'd go in, you'd do your work, you'd come out, and then a different shift would go in a few hours later. So the patients didn't get a lot of care. You couldn't be in there because you're in all that stuff and it's so hot and you're sweating so bad. And in this situation, they had actually, at this place, they were designing a little playpen area because they'd recently had a 2-year-old, and the child had gotten out of the little cot, and the patients don't have a toilet, right? So they have 3 buckets. They have a bucket for their personal belongings. They have a bucket to puke in and a button to go to the toilet in. And they're sitting in front of their beds, and the child had gotten out of the cot and was playing in the buckets of an Ebola patient. So they were freaking out. They were frantically trying to get their PPE on to get in there and get this kid. So they were trying to come up with a way to create like a playpen out of fencing to keep the kid in that area. So it was very, very challenging nursing because you have adults, you have children, everybody all mixed together and no way to provide the care for them. This center here was beautiful. I called this the Taj Mahal. They had Wi-Fi. They had air conditioning. The patients hated it. They hated the air conditioning. They were too cold. They're not used to it. So the air conditioning was great for the staff, but they couldn't use it because the patients found it way too cold. So they ended up never using it. But it was really quite a lovely setup. And these are some other ones. These are just intense. But again, they had nice little cots. These were new centers that they were designing, and it was really coming along well. This is the one, the Taj Mahal here. You can see the air conditioning. And they even had overbed tables. It's really exciting. And I thought to myself, for these patients with the buckets, oh, we should get them like a chair. Because just imagine trying to squat over a bucket when you have Ebola and you have that bad diarrhea, right? So we got chairs, and they would cut a hole, like, you know those plastic lawn chairs, the white plastic lawn chairs? They would cut a hole in the middle and put it over the bucket so the patients could sit down, but most of them didn't want it. They're used to squatting over a hole, so like that's me bringing my Western values and ideas and thinking, oh, we should have chairs for them. They didn't want chairs. Some of them did when they were really sick, but you have to look at the whole flow, where patients are going and where your hand hygiene is located, so why this is sitting in the middle of nowhere isn't really clear, not very effective, and yes, sometimes there were chickens. Not really sure why there was a chicken. There was a chicken. The real challenge was creating a place for caring for patients in Ebola in a hospital that already exists. Right? So you're dealing with a structure that's poorly designed to begin with, and you're trying to put that in. So here's a situation we were going in. You put our donning on here, so you put all your PPE on. You went into the room, and you went through all these old supplies, and then around the corner, which everything's rusted and kind of nasty, was the floor where all the pregnant women were lying who were probable Ebola. So it was really, really unfortunate, but we did manage to create a new area while I was there for them to put the pregnant women. This place was a nightmare. Lots of issues there. They had done the best they could, trying to create a place for the Ebola patients. But in behind me here, this is me getting all my stuff on with the team, getting ready to go in and see it. And there's a board that they'd put up, and the people were coming out and just lying on the floor. And then there was a lot of commotion that went on. They had a new case that was confirmed Ebola. They were trying to send them to an actual treatment center. The girl wouldn't go, and there was a lot of arguing and yelling, and I was trying to figure out what was going on, and then they threatened to shoot her if she didn't get in the ambulance and go. So, I don't know. It's like, okay, guys, that's not really a good plan. This is the hospital in Kono. Remember I mentioned going to the place where they found all the bodies? When we arrived there, basically, the whole hospital had been contaminated. There had been patients everywhere. I didn't know who had Ebola, who didn't. They had put up these little tapes all along the area, but when I got there, all these people were standing around, and I didn't know if they were visitors, who was a possible Ebola case. They were just kind of all hanging out together. This was the main well, and everybody was hanging out at the well. So you don't know what's happening to the water source, right? In fact, the well didn't work because when we needed to clean it, we found out that they had no running water left in the hospital. The staff were basically just wandering around in full PPE, just going everywhere, contaminating everything. So we did a lot of work with them, and the Red Cross, and actually quite a number of them were Canadians, came in there and helped out, so it was really good. We looked at the triage. So the triage process itself was a challenge. This is their flow chart. Can you imagine trying to figure out what to do with these people when you look at this flow chart? And most of the people that were doing triage were probably not even healthcare trained. They were just random people that they found that they would hire and put them in the triage. Cleaning and disinfecting, we all know that's a huge piece and really, really important. We didn't have soap. I don't know why we could not find soap, but I could not find soap. We did have some alcohol-based hand rub coming into the country, but not a lot. So their main product was chlorine, and they would mix it in buckets. And you either got these big, this is a big bin of chlorine powder, this white thing here, and they would mix it in the buckets. The problem was it wasn't always mixed properly. These a lot of the people are uneducated, and so you had to have pictures, this many spoons to this size of a bucket, and a lot of times people calculated it wrong, and we actually had a number of times where staff received significant chlorine burns. So their entire arm would be burned from chlorine, and we'd have to take them off work. We had to send a nurse home because of it, back to like somewhere in Europe. She stuck her hands in, and the chlorine went down her gloves, and she ended up with burns on her arm. Well, you can't be in an Ebola center where your skin's not intact. So we saw a lot of chlorine burns. One facility I was at, I was literally coughing the entire time because the chlorine was so strong. I was like, I can't even breathe. I had to leave. I'm like, I got to get out of here. Like, I cannot breathe. Once my gloves melted, that scared me. I was cleaning, and you know, your gloves start turning brown and melting, and it's like, I think we have a problem here. My gloves are melting. Never seen gloves melt before, but they can. Hand hygiene was with buckets. They did not have running water, so they put the chlorine solution into these buckets, and you had little taps, and you would run the water to clean your gloves or clean your hands. Unfortunately, sometimes, and I understand their rationale, the buckets would get run out of water and there wouldn't be water, so they came up with the idea of putting it all in these basins, and then you could clean your hands in that. Well, the problem was that would sit there for 4 or 5 hours in the sunlight, so of course your chlorine's not effective anymore. But also, so this guy stuck his hands in the bucket, and now this guy's coming behind him and sticking his hands in the same water, and then the next person's coming and sticking their gloved hands in there, and it's just person after person after person. So trying to re-educate them on not using these buckets was really, really difficult. And I got a few places to change, but a lot just wouldn't change. Even once we opened the schools, hand hygiene was a big issue. So we worked with UNICEF on trying to figure out where to put the buckets for hand hygiene. They were planning on one hand hygiene bucket for every 50 students. So if you had a school, small school, with less than 50 students, there was one place to wash their hands. So where do you put it? I wanted to put it by the toilets. UNICEF wanted it at the front entrance. So it ended up at the front entrance. They're like, oh, the kids will come from the toilet and walk out to the front. No, they won't. Nobody's going to come from the toilet, walk all the way across the schoolyard to the front door to wash their hands after they've used the toilet. But that's what they were funded for. That was the money they were able to get, was one bucket for every 50 kids. Not a lot of hand washing. And these are just some pictures of some variety ways, creative ways that we got water. So it was really challenging. Having a place to take your PPE off was really important, and it was all over the map. There were standards from WHO, but everybody kind of adapted things and came up with creative ideas that often made no sense at all. Why you would be standing in a bucket of chlorine in your rubber boots, I have no idea what the purpose of that is, except that I can tell you it did feel kind of nice if the water was a little bit cool and you were really hot and you were waiting. It's like, oh, my feet are cooling off. Other than that, I don't know what the purpose was, but they really were focused on cleaning their boots. It's kind of like we get focused here. Whenever there's an outbreak, everybody wants to put booties over their shoes. Why? I don't think we feed our patients with our shoes. If we do, we have another thing to talk about. They would spray you. Some of the places did this. I think you guys probably saw that on TV, on the news, the spraying of the people in their PPE. Actually, that's not recommended by WHO. We don't want to see people doing that. There's a lot more risks. We saw chlorine going up on the masks, people getting eye burns. It's really dangerous. You could be actually aerosolizing that virus, spraying it all over the place. So we really didn't want to see that, but sometimes these things get put in place. You don't know why, and to try and change practice, really difficult. Here's another place. Here we didn't have any running water, so they were spraying the guy. Trying to clean the equipment, most of it was disposable, but some of it was reusable. Masks, face shields, a lot of rubber gloves. So they would just rinse it in buckets of chlorine and leave it out in the sun to dry. Sunlight will kill the Ebola virus. So they looked like little boot and glove graveyards everywhere. So gloves on sticks all over the place, drying in the sunlight. But cleaning in general was really challenging. Water and sanitation was responsible for cleaning. You guys probably remember seeing pictures of people with the sprayers. And the thought was they would walk around and they would spray. So here we had just loaded children who were Ebola positive, a young fellow. We just loaded him on the ambulance and sent him off to a treatment center. So they were coming behind and cleaning the area by spraying. So there's a big pile of stuff there and you spray it. Where's it going to go? What's that cleaning? Not much. We know for infection control cleaning, you have to physically remove it and then disinfect. If you have chlorine and you have body fluids, chlorine is inactivated in the presence of protein. So if you have body fluids, the chlorine's not effective. So it was a lot of spraying of stuff that really probably did very little. This, of course, as a result of all the chlorine, everything that wasn't wood was rusty and looked really nasty. Waste management was an issue. Hospitals didn't even have a place to put their garbage. So you dug pits and you burned it and threw it in the pit. And like I said before, this is just a picture. You can see the smoke. This is garbage. Again, there was no city garbage. It was just piled up in this area. They would occasionally pick up garbage, and it would all be in this area, and they would try to set it on fire and burn it. But you can see here's the houses, and the garbage is up higher than the houses. And the little kids would be running around there. I would drive past this every Monday coming home from a meeting, and you drive past and see the little kids running along there. And then along it was this river coming in, and they had pigs. Don't eat pork in Sierra Leone. They had pigs that were eating all the garbage, and I know they found a couple bodies that people had left there that were probably Ebola cases that the pigs ate. It was really nasty. So we just, and you would see people in this water. And of course, diphtheria, dysentery, all that's really prevalent there as well. Places didn't necessarily have running water, so we trucked it in, and they had great big, 4,000 liter plastic tubs that they would mix their water and then try to pipe down. But because we mixed it, with chlorine, it was always degrading the plastic, and they were constantly having water leaks and issues with water flow. It was a constant battle, really challenging. But there were survivors, so I like this picture because these were some of our survivors waiting for discharge, and they really tried to make it a celebration. They would get a kit, some food and some money and stuff before they left. And unfortunately, this is one survivor wall at one of the facilities I was at, and they treated probably 100 or so cases. This was the survivors that came out of there. When we first, probably early on in the outbreak until probably mid-January, mortality rate was between 70 and 90%. So, you didn't have much chance of surviving. Towards the end of the outbreak, as we moved and put things in place, we were looking at about 50. So that was a huge improvement. And just of interest for you, being there, we did some community outreach as well. This is an orphan center. It was actually for orphans or children whose parents were in Ebola treatment center who were not sick, but were contacts. So they had to be kind of monitored for 21 days. Sometimes families would take children in, but sometimes everybody was so afraid they wouldn't take the kids in, or if they did, they were treating them really badly. They weren't feeding them. There's a lot of abuse. Kids were beaten up. So they would try to find these kids and bring them to these treatment centers. The people who took care of them were typically survivors, because if you've survived Ebola, you're not likely to get Ebola again. So that they could take care of the kids and not have to be in PPE the whole time. So this was a place that I spent quite a bit of time doing some work with, and unfortunately one of the workers there while I was there faked a discharge certificate. So they would get a certificate saying you survived Ebola. This girl faked one. She made a fake copy so she could get the job, because there were no jobs, because her whole economy's been devastated. And she was pregnant, and she was taking care of one of the kids who ended up having Ebola, and she contracted it, and both her and the baby died. It was really sad. And the guy that, Kappa Anamur is the organization out of Germany that was running this place, he was just devastated that one of his staff, and that someone would be so desperate to fake something like that. But I will say here in Sault Ste. Marie, because I was there, a lot of friends and colleagues were looking to support the people of Sierra Leone, so they sent a lot of donations, and we made a huge donation to that orphan center, and it was kind of fun to bring them food and some toys for the kids and diapers and some cash as well for ongoing support. We also made some private donations. This is a little school. I used to go for a run in the mornings, and this little school, it was a secret school. They really weren't supposed to be having school, but they would have their little benches out along the side of the road, and they were doing their letters and doing their teaching, and we bought them some notebooks for the kids and things like that. It was kind of fun. This school was just up the street from our hotel, and we were talking to the teacher one day. It was closed, and we collected some money for books and stuff for when it opened. But then right before I left, remember I said that there was a huge outbreak in that fishing village? It impacted this neighborhood as well. All of the shacks that were right up the street from our hotel were all under quarantine, and the military took over the school, and they had their soldiers in there, because when you were put on quarantine, they'd put a little yellow, like a police ribbon around your place, and then to make you stay there, they'd post either a policeman or a soldier or somebody with a gun that would make you stay in your house. Otherwise, people were escaping. So they were using that facility during that time frame, that quarantine period. But the staff from WHO, after it was finished and ready to be opened, they went and on their own time, after very long days, they would repainted the school and provided some money to get that school reopened for that area. So I guess for me, being there was really, like I said, I was looking at my journal and I realized how exhausted I was. I think in the 3 months I was there, I had a total of 5 days where I actually had the day off. Typically I worked every day from 7 o'clock in the morning till 10 or 11 o'clock at night. They were very long. I could sense, reading my journal and looking back, it was like very frustrating, very stressful, exhausted. But I really felt privileged to have been there, and it's an experience I'll never forget. And the people that I worked with were amazing. So this is my driver and his wife and his new baby boy. Yeah. And he was so excited to bring me down, but I wasn't allowed to go to his house. We weren't allowed to go to people's houses because of the risks. So he brought his wife and baby out to the street to meet me, which was really, really nice. I wanted to hold the baby so bad, but I didn't dare because I'd just come out of an Ebola center. Touching the baby. But the people were amazing. Like, in spite of everything that they've been through, they're hopeful, they're resilient, they're positive outlooks. It was really incredible. And the countryside was absolutely stunning and beautiful. And I really hope that for the future, they have a positive future, and they can. It's unfortunate they've had a couple more cases recently and several hundred people under isolation, but I'm really hoping that they can get this going and rebuild their country. So thank you, if there's any questions. Any questions or comments? Yes, good question. It was. Remember I said there's multiple agencies? There was also multiple languages. So although English was the main language, a lot of people were from all over the world, and they could speak English, but we definitely had a lot of misinterpretation. And the Sierra Leoneans themselves, although they speak English, their main language is Creole, or they may have other languages as well, tribal languages, and their accents were so thick, like, honestly, half the time I was like, what am I saying? I have no idea. And when I went to Kono, at one point they were speaking in Timinde, it's a different tribal language, and the chief finally said, okay, for our visitors here, we need to speak in English. So they started speaking in English, but the accents were so thick, I really still didn't have a clue what they were saying half the time. It was really challenging. I got better as the 3 months went on, but at the very beginning, it was hard. Add to that, all of the people that are there for the resource, many of them don't speak English, even in our own team. So here, this guy here, Allah, he was our lead physician for our infection control team, but he was Egyptian. And he could speak pretty good English, but between him and our other support person, Batizan, was from Turkey, and then there was me. So he'd be talking, and she didn't understand what he said, and I'd be going, okay, Batizan, Allah's saying this. And then this is just sitting in our office trying to figure something out, and I'm like trying to coordinate and understand what they're saying, because nobody really understood each other some days. And then documents were really interesting. I ended up spending a lot of my time at night when they would put together policies or guidelines, because so many people, English was their second language, you'd be reading it going, what? What are they talking about? And I'd have to rewrite them in English for them, so that was my after work time, rewriting documents so they actually made sense in English. It was challenging. So, yeah.
Were you ever afraid that you would get Ebola?
Not typically. Like I said, there was really only two instances where I got scared. That was when those kids were charging me in Kono because it was a massive outbreak happening there, and I didn't want them touching me. That scared me a little bit. And going there, I wasn't really worried. I knew what I needed to do. And the only other time I kind of had a little moment of panic was I was looking at a new Ebola center. They'd just had a couple of cases, and they'd had a lot of design issues, and I had gone back to look at it. And as we were walking past the area where the patients are kept, there was a really, really bright sunlight, and there was a thin wire hanging, and I didn't see it, and it cut me on the arm. And I was like, slice. As I walked past, my arm hit it, and it slice. And I was like, I've just been cut by a wire. Who has this happened to them? My friends that know me are all like, I can't believe you're going to Ebola, to Sierra Leone. You're like a walking disaster. Things happen. I got bit in Poland just a couple weeks ago. Like, seriously, who has these things happen to them? So when that happened, I kind of went, oh God. So I just went over and like washed it really well. And I mean, I was fine because I'm thinking, really, it hasn't touched anyone. I know I'm fine. But for that brief 30 seconds, your heart's pounding, and it's like, oh my God. But yeah, other than that, no, it was fine. And I never got food poisoning either. I was lucky. I did in Poland.
During that time here, I remember being afraid of Ebola myself,
Mm-hmm.
and I think around, I guess more South countries, there was a bit of a climate of fear. Was it the same way there, or were they more, were they educated enough to, know?
The healthcare workers were very afraid, but they had reason to be afraid. They were dying. Here, and I think for me coming back, this has been the hardest part, even going why I had to go. When you look at how Ebola happened there and the transmission, and I've pointed out over and over again, the lack of sanitation, the lack of places to wash your hands, there's no toilets, the fear was very real. And it was really weird because there was a fear of getting it for the healthcare workers, but the general population kind of just still didn't believe it. Like, my driver told me, I'm not going to stop eating bushmeat. I've eaten bushmeat all my life. Why would I stop? It'd be like telling people here, you can't go hunting this season. You shouldn't eat, they're going to be, what are you talking about? We've done that our whole lives. So there wasn't that fear there. There was definitely among the local healthcare providers. But on a routine basis, they did not even have things like gloves. Okay, so in their hospitals, it was rare to have a pair of gloves. So when a case would come in, they had nothing to take care of these people. So their fear was justified. When I look at what happened here and in the rest of the world with the fear, it was way out of proportion. And I still have a hard time. I know in the hospitals here in Ontario, we still have Ebola measures in place, right? So we're still screening, and the staff have to wear all this stuff if you don't have a plexiglass. And for me, I just thinking, what a waste of resources. Like, this is ridiculous. How are we going to get Ebola here? If a case did come in, if somebody did get sick at home, well, guess what? They have a toilet. They can wash their hands. There's not going to be body fluids all over the dirt floor of your house. So, getting the public to understand that, unfortunately, that just didn't happen. You have to look at the environment where this is happening versus the environment here. It's very different, yeah. Yeah, there's actually 2 or 3 vaccines that they're trying. So that's what's happening right now. And one of the vaccines is Canadian, so that's really exciting. So they were working on putting the trials in place while I was there. I actually met with the vaccine trial people a couple of times to talk about it. So they are working and things are going really well, so it's really promising. There were a lot of issues around trying to get the trial started that took so long. The vaccine has to be refrigerated at or frozen at -80 or something like that. So in a country that has inconsistent electricity, how are you going to keep a fridge or freezer at -80? Really challenging. And then what do? You know how you can get a vaccine and then you can have some symptoms, right? Some mild symptoms. So in the middle of an outbreak, how do you give people a vaccine? And then if they become symptomatic, do you really want to put them in an Ebola center? where they're really exposed to it. And we know transmission is likely happening in those Ebola centers, so really challenging to try to figure out what do you do if you give someone the vaccine and then they have a bit of a fever the next day. Where do we put them? So they were working on all of that. It was really challenging, but it's looking good, very promising. Even at one point they wanted to do a blood drive. They needed blood products. Okay, I understand that. But having a blood drive where you have people coming by the hundreds lining up to donate blood in the middle of an Ebola outbreak that's spread through blood is probably not a good plan. So we had to stop that. It's like, I don't think so. This is not a good plan. Especially when in the middle of all of this, we started seeing, of course, there's no immunization programs, right? What it's cropping up? Measles. So suddenly kids are coming to an Ebola center for assessment because they have a fever and a rash. They had measles. Measles is spread by airborne. Do we really want to admit that child into an Ebola center where there's no ventilation to give it to everybody else who's probably not immunized? No, we don't. So we wanted to get blood testing done, so the doctors were doing blood testing, providing some vitamins and treatment and sending the baby home. And then we found out through a conversation that all of the samples we were collecting and sending off to the lab, they were refusing to test until they tested Ebola first. We don't need to test them for Ebola. We know they have measles. It was really difficult, so we couldn't get a handle on how many cases we were having and whether we were potentially having a measles outbreak in the middle of an Ebola outbreak. It was really scary. I think it settled down and they have some immunization happening now. Mm-hmm. Well, I think it was exhausting, but it was a crisis situation, right? Like I wouldn't recommend that for long term. And what WHO offered was every 6 weeks you could take a week to go for R&R. Me being an idiot, thought I don't need to do that. I thought to myself, well, I'll just take a few days here and there. That would be better for me. And that was my plan. And because the R&R, you literally had to leave the country and go somewhere else. But you were limited on where you could go, and you had to pay for it out of your own pocket. They would fly you there, but then all of the expenses you had to pay for. So I was thinking, well, I'm just getting comfortable here. Do I want to go to Ghana and stay in a new place that I have no idea anything and adjust to something new for 5 days? Like I just thought, okay, I'm just going to take some days. And that was my plan. And I was reading my journal and I had this elaborate plan over New Year's. I was going to take 2 days to relax. There's a nice hotel in Freetown, and I thought I made arrangements for a nice room because it had a nice bed and like a really hot shower. And I was really excited. And they had a pool. And I thought I could just relax. New Year's Eve, I think I ended up working till 1:30 in the morning. And then the next day I ended up having to go because that was the day, remember the British nurse that went back to England and ended up having Ebola once she showed up. So I had to go and investigate all of that. So there was a crisis that happened. So my 2-day of rest and relaxation got completely canceled because we had in the country at that time, there was, I think, 4 of us for infection prevention controls, spread out across the country. There was nobody. So tried. We did manage to get some days, and I became the coordinator of the trips to the beach. Not sure how that happened, but I coordinated our half-day trips to the beach for relaxation. But you're right, it is something you have to be aware of, and I knew by the end of my time I needed to leave. I was at the point I needed a break. And so I was thankful I was leaving and going home and I think for a month I was completely exhausted. They do try to provide time for you to rest and take that time. But it is important. Any other questions?
Did you experience culture shock when you first entered the country? And if so, how did you deal with it?
I think yes. You're kind of shocked at what you're seeing, but you're in such a crisis mode, you kind of just go with it and you just deal with it and you accept it and you just move on. And I had my moments where I thought, I can't take this anymore. I had a day where I was at the WHO office, and I kind of had a little meltdown, you could say, because there was no functioning toilet. I was like, come on, this is the head office for World Health in the country, and they don't even have a toilet that's not covered in ants. Like, seriously, I can't take this anymore. But overall, it was so busy, and there's so much work to do. I just did that. I think what was harder was actually coming home. That was really difficult, and that surprised me. I didn't expect that, but I think it's that coming out of this moment of crisis and this intense time, and then coming home and trying to get back used to being with your family, because I'd been away from them for 3 months, and get the rest because I was exhausted, get back to work, and just seeing what we were doing for Ebola in this country was overwhelming to me, and I just couldn't accept it. It was just like, this is ridiculous. We don't even have any cases, and they're doing with so much more with so much less in Sierra Leone. So I really struggled, and I would say it probably took me 3 months to feel like myself again. It was really hard. You meet with a psychiatrist and everything when you come back too.
Did you keep any form of contact with any of the people that you worked with, like your dad or something?
I do, on Facebook. With Wahid, the one young fellow, a friend of mine gave me a laptop, and I left it, and I gave it to him when I left. So he has a computer. So we're friends on Facebook. And there was a young nurse I met, and I gave her my boots. I had these rubber boots. They were the only boots I could get in Canadian Tire. They had dogs all over them. They loved them. So I gave her my boots, and so we still keep in touch and message each other. And a couple of the nurses that I worked with, we connect through Facebook, email, that sort of thing. So I do try to stay in touch with people. I wish I could keep in touch with my one driver, Amin, but he doesn't have a way that I can keep in touch with him. So I just kind of go through Wahid. How's Amin? How's he doing? So, yeah. So for me, I work for Public Health Ontario. So what we do is we do provide scientific and technical advice specifically, of course, for infection prevention and control. So our role is to support the hospitals and the infection control teams in preparing for Ebola, that sort of thing. So yes, we are involved with that. We provide advice to the government. Whether they choose to listen to it or not is another thing. But anyways, lots of things at play there. So we are involved with the Ebola directives that are out. They're not necessarily what our organization recommended. They have to take other things into context. And then, so there were 4 of us, actually. I really have to say Public Health Ontario was very supportive in allowing 4 of their staff to go at different times to West Africa. My one colleague went to Liberia for a month in October. I was gone for 3 months in November, and then it was kind of cool because just before I left, 2 close colleagues of mine came to Sierra Leone and took over for me, and they stayed for 3 months. So now ongoing, we are looking at how we can continue to support the development of infection control, and we're talking to Infection Control Africa Network, which is like an association for infection control, right? Like IPAC Canada here. So Public Health Ontario is having some conversations on how we can support and get involved, and then I'm also doing it personally through my chapter. We're looking at how we can partner to support ongoing education. No, this was my first time working in something like this. So I think I was lucky that I got picked to go. You had to apply, and they really wanted people with experience. Well, the reality is not very many people in infection control have ever worked in this kind of an environment in Canada. But I think, I don't know, I got lucky. I've lived when I was young, I've lived in other countries before. I've lived in South America, I lived in Brazil, I've traveled a lot. So I think that probably helped. I'm comfortable with different cultures and that sort of thing, so that probably helped in getting picked to go. Maybe because I live up north and I'm used to not having my cell phone work around here. I don't know. But They just looked at your experience and interviewed you, and then they would decide if they would accept you on the team. So, but a lot of people that I met that were in epidemiology have definitely worked in a lot of different areas, but I think in terms of infection control, not so much. So it was quite an experience. Mm-hmm. I think you have to, for ongoing change, I think you have to do the education. But when you're planning your education, you have to understand, take into context the cultural situation, and you also have to look at the funding, right? So there's no point in going in and setting up a system that they're not going to be able to sustain because they don't have the money. So you're going to look at your education, but how are you going to make it sustainable for that country? And that's what World Health Organization is trying to do. And that's why we thought, well, let's start training the nurses and doctors that are already working and getting them aware about infection prevention control, and then working with them. They have a mentorship program that they're doing right now. So they have experts from infection control from other countries. They're on the ground, and that's what my colleagues did once I left, because I was there more for the outbreak response, to mentor and help them figure it out and learn, applying the principles of infection prevention control, routine practices, hand hygiene, cleaning and disinfection, in the setting that they work in with the resources that they have, which is really what we do here in Canada too. We just happen to have a lot more resources. Okay, I think I ran over. Sorry about that.
Sorry, can you stay up here for a sec? All right, thank you so much, Vicki. So just on behalf of the CNSA and the NCPC, we'd like to present you with this little gift for coming as our guest speaker. So give it up for Vicki.
Thank you.